NDTV 24/7.
Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat, and today on the show we're focusing on children going back to school and also about vaccinations and children in India. So far what we do know is that the government plans to begin COVID vaccination of children in the 12 to 17 age group among those who only have comorbidities like obesity, heart disorders or immunodeficiency, and that is expected in October and November. The plan keeps in mind that supplies of Zydus Cadilla's DNA vaccine, that ZyCoV-D, the only one to have received emergency authorization for use in children so far in the country, are likely to begin in October. Around 20 to 30 lakh children with comorbidities will be eligible for the vaccines then. The government expects to further expand coverage among children by March next year when more vaccines will be available. Now, if we take a look at schools opening and how classes for senior students have been ongoing in several states for the past couple of weeks now, well, a survey of parents by community platform Local Circles in 388 districts of India found that 84% of parents whose children are now going to school say that mask compliance is effective, while 70% feel social distancing, hygiene and sanitation compliance is effective, but lower than those who feel mask compliance is effective. So some concerns about indoor assembly, some concerns about children during the break eating their food and whether that could be a risk factor. Well, to talk more about these issues, we're now joined by Dr. Rajesh Parekh, Director Medical Research, Jaslok Hospital, Mumbai, Dr. P.V. Rama Rao, Chief of Children's Services and Director, Andhra Hospitals, Vijayawada, Andhra Pradesh, and also Sachin Tarparia, co-founder and chairman of Local Circles. Dr. Rama Rao, I'd like to start with you. A lot of concern around children. Before the schools were to reopen, many parents felt that, we should wait for the vaccines, only then open the schools. But now we do know that vaccination for, the general children population will only be available next year.
Yes, if you look at the survey, about 63% of the people, the parents, they've said that they just want to go for the vaccination for their children. But it's going to take time. The Zydus Cadila vaccine is almost ready. They will be starting vaccine in the month of October, end of October or in early November. So, with regards to the schooling, they've almost lost about 1.5 years of time just because of the new COVID. So I think this is a time to start schooling and take all precautions and wait for the vaccine. Because to get a vaccine to all the children, it's going to take time. It will take at least 6 months to 9 months time to get all the children vaccinated in India. So I think, in my opinion, it's good to start schooling. We've already been started in all places and wait for the vaccine. And this is the good thing to start vaccine to the high-risk children. That includes, as you mentioned, the children with obesity. The risk is high in those children, and children with heart disorders and immunodeficiency. And then after that, you could extend to other normal children. So I think it is a good move, but at the same time, we're not not supposed to alarm about the what's going to happen to children or not, because most of the times, most of the children are asymptomatic. Even though they get infection, recovery rate is really good. So take all precautions and go for the vaccine and wait for the vaccine. That's my answer.
Talking about vaccines, Dr. Rama Rao, we do know that ZyCoV-D is the vaccine that's going to be available first in India for children who have comorbidities. Right now, the focus is on vaccinating the adult population. We're hoping for more vaccines. Which other vaccines are we going to get for children? The UK has just decided on a single-dose Pfizer vaccine for children between 12 to 15 years of age. Looking at the data so far, and ZyCoV-D is going to be a whole new vaccine that we're going to be using.
Yeah, so with regards to the vaccine in children, UK had given the approval for Pfizer vaccine. That is basically it's a single dose vaccine for the ages between 12 to 15 years age group. And then US has already started, we all know that, they're giving, Pfizer vaccine, and also they've started Moderna as well. And in other countries and other European countries also, they've started vaccinating children above the age of 12. If you take, Denmark, Spain, or Italy, France, Sweden, and Germany, they've all started, and they've already completed about 40 to 50% of the children. They've already got, some vaccine. So I think this is the time to start vaccine in our country as well. Jadis Cadila is the one, they're almost ready, and they got the approval as well. So in that, mainly it is a DNA vaccine. This is the first, the world's first DNA vaccine manufactured by Jadis. So that is basically, it's a plasmid containing DNA vaccine encoding antigen. So that would be really useful when compared to other vaccines. I'm not saying that other vaccines are not that good. So it's a DNA vaccine has got its own advantages. It basically stimulates T cells and B cells as well. So this is really useful, and I think it's a good move to start DNA containing vaccine in our country. So definitely it's useful, and we'll start with high risk children first, and then extend to other to normal population in due course.
All right, and we do know that Covaxin is also being tested on children currently, and hopefully we will have more vaccines. There's Covovax as well next year, which we're expecting to get approval. Dr. Rama Rao, currently in our country, as we've been saying, not enough adults are vaccinated, and right now the focus is on covering as much of the population as we can, isn't it, to be thinking of booster doses? And I've also heard if we do have them, there may be more of a mixing of vaccines. Your view on this?
Yeah, I think we're not at the stage of giving booster doses yet. When compared to other countries like the UK, US, UK, they were nearly completed. More than 85% of population have got the vaccine 2 doses. So they're ready for the booster dose, and they're about to start it. In the elderly age group, so mainly above the age of 50 years. So our country is not ready yet. Our concentration is mainly on doing vaccination in 2 doses. That's our first priority. And so far, about 75 crores of people have got vaccine, first dose. So our priority is to complete the first dose and then second dose as well, and then we'll come to the booster doses. So our country is not ready yet. And we don't know about the efficacy of giving a booster dose at this point of time. So I think my answer to your question is to concentrate on first and second doses first, and then we'll consider about the third booster dose in our country.
All right. Thank you so much, Dr. Parekh and Dr. Rama Rao, for joining me on the program.